Hello, I'm David Pipes. I'm the Head of Capital Services. New building works, refurbishment works, alterations, backlog maintenance repairs and they're like anything from no value all the way up to multiple millions of pounds. Since COVID and Brexit is that the construction market is getting tighter and tighter. There's more squeeze on margins and costs have been inflated quite significantly. Unfortunately, budget costs, capital CRL limits, CDL limits have not increased, so the amount of work that we can get through each financial year with our capital budgets is becoming less and less. Problems in terms of being able to recruit the right numbers of staff, the right quality of staff to come and work for us. We're trying to expand our team at the moment. Over the last 6 months, unfortunately, we haven't been able to recruit any project managers. We provide those facilities that are going to improve our estate, and that is a massive plus and a job satisfaction for myself and my team in terms of their enjoyment of working in the NHS and the good that it brings to our population. I'm also proud of the fact that in the team we have a number of people who've come through the ranks, so to speak. So we've had students through undergraduate schemes that have come through, got their degrees at university, come back to us on full-time employment and are now working their way through the various different bandings, project officers, etc. And also apprentices in admin. We've got people who have been taken on full-time since undertaking their apprenticeships, that's a massive coup for us and one that I'm really proud of. We feel as though I feel as though we're a very collaborative team. We're open to discussion, we're open to ideas, we're open to networking across our own sector in construction, but also in the other NHS colleagues throughout the country and certainly the local regions. We feel development of Sherwood Oaks. We had quite a significant challenge initially in so much that we took on a building that was 10 years old, and the trust thought that it was a perfect kind of solution for our patient care, which it is. It provides the right beds, the right number of services, it eradicates our dormitory accommodation. However, when we started work, it was quickly significantly lacking in terms of its health and safety, fire safety especially, parameters. The original budget or the original brief to actually do a quick turnaround and get the patients moving was not going to be possible because of the significant risks that we were left with. So we stripped the building back to its bare bones and we improved the fire safety at significant cost and time, as we all know. However, I do know that it is probably one of our most compliant buildings that we are now having the trust, and the outcome of the work has been significantly betterment for our patient population and our staff to work in. We're trying to expand our workforce to be able to cope with the numbers of projects that we deal with and the governance that comes with. One of the significant changes that coming in alignment with Capital Services, the post of the Programme Director, which has currently been advertised. So we look forward to working alongside whoever that may be in developing our major capital estate of the future. We are a credit to the Trust. We have a diverse workforce of differing age, gender, backgrounds, and we're able to meet the needs of the Trust values, the values that the Trust has through our contracts, through our consultants, and also which then gets presented in our works and how we work with stakeholders and our client groups and patients.